national rules or restrict transport systems serving local areas. I know it will be hard going for people affected by these local measures. It isn't easy, and for some it may seem unjust that people just a short distance away can live their lives closer to normal. But it has to be right that we take local action in response to local outbreaks. There is no point in shutting down a city in one part of the country to contain an outbreak in another part of the country. Now, of course, this local approach relies on having an effective testing regime in place. And here we have made substantial progress. Antigen test capacity, that's the test which tells you if you currently have the virus, has increased 100-fold since the start of March, from fewer than 2,000 tests a day to more than 200,000 tests a day now. Publicly available data suggests we are now carrying out our tests more than anywhere else in Europe in total, and more tests than Germany, France, Italy, and Spain per capita. We've set up testing sites around the UK and now have 200 mobile units which can be rapidly deployed wherever they're needed. It's now the case, and has been for some time, that anyone, anywhere in the UK with symptoms can get a test without delay. We're also testing increasing numbers of people who don't have symptoms but who are at higher risk. As we approach winter, we will need to go further, not least as many more people will show COVID-like symptoms as a result of seasonal illnesses and therefore require a test. So we will further increase testing capacity to at least 500,000 antigen tests a day, that's 3.5 million antigen tests a week, by the end of October. Demand for testing is not the only challenge that winter will bring. It's possible that the virus will be more virulent in the winter months, and it's certain that the NHS will face the usual annual winter pressures. We've taken a number of steps, therefore, to get the NHS ready for winter. We have massively increased the number of ventilators available to patients across the UK, up from 9,000 before the pandemic to nearly 30,000 now. We've substantially increased the pipeline of personal protective equipment for the NHS and social care, constituting over 30 billion items of PPE over the course of the pandemic. We will be rolling out the biggest ever flu vaccination programme in the history of the UK. We will also, of course, give the NHS the resources it needs. And today I can confirm that we're providing an additional £3 billion of funding to the NHS in England to get ready for winter. Scotland, Wales and Northern Ireland will also receive additional funds. This will allow the NHS to continue to use the extra hospital capacity acquired from the independent sector, and also to maintain the Nightingale hospitals until the end of March. This new funding comes on top of the additional £30 billion of funding for health and social care that we've already announced this year. So we're making sure we're ready for winter and planning for the worst. But even as we plan for the worst, I strongly believe we should also hope for the best. That means looking ahead with optimism, now extending our plan to lift the remaining national measures which have restricted our lives since March, so we can get back to something closer to normal life. Now, I must stress the timetable I am about to set out is conditional. It is contingent on every one of us staying alert and acting responsibly. It relies on our continued success in controlling the virus, and we will not proceed if doing so risks a second peak that would overwhelm the NHS. Nonetheless, it is important to give people hope and to give business confidence. So, in England, from today, we are making clear that anybody may use public transport, while of course encouraging people to consider alternative means of transport where they are available.